Good morning. Welcome to another edition of I
Wonder.
Wednesday. Today we're going to be discussing sports injuries and how they affect kids mostly, but adults as well with the eyes. What would you say the most common sports injury you see in the office?
We see a lot of just like contusions, and that can be in almost any sport. It can be in basketball with an elbow. It can be in volleyball when somebody's taking a swing and misses or misses the ball completely and it hits them. But those kind of vary in severity. Like I've had, mild ones where the eye is swollen, but we still get a good look at it. We can still tell if the patient can see. And I've had very severe ones, baseball to the eye socket, where it breaks the bones underneath in the sinus and on the medial side on the sinus. And those are definitely more of a concern. The eye is swollen so badly, you have to get those eyelids open and make sure the eyeball is still intact in one piece. You can get an idea of, whether the patient can see that way as well. But it's not easy, and it's a little bit scary. So as a parent, the initial thought is, let's rush this patient to the emergency room and get this looked at right away. It's a great plan. I feel like as part of that, they should have a consult with an ophthalmologist or an optometrist that can get that eye open and make sure that the eyeball itself is intact, because that really increases the urgency of that referral. A surgery on a broken medial or inferior wall of a sinus might be an emergency. It might be that the patient has to wait a week or so to let the swelling go down so that the surgery can be performed. And what the eye looks like and what the muscles around the eye look like have a lot to do with that.
They do. So one of the things we like to educate patients on is, how do you prevent that? My sons play baseball, and those lovely cheek guards that are not cool to wear when you're batting? Yeah, you really need them for this reason. A baseball, unfortunately, the size of a baseball is about the size of the eye socket. And so if you take that directly to the eye socket, it can cause some pretty decent damage to that eyeball, especially when you're starting to get in the older ages where they pitch much faster. So it's very important that you wear those cheek guards. Let your friends make fun of you. You won't be the one with the broken face down the road. We also do have safety eyewear. And they are specifically made for sports, so that if a child is playing sports or an adult's playing sports and they get hit, they're not going to break and cut them. They also they sit on your face a little differently. They don't have the little earpieces that go behind your ear. They're more of a strap that goes around the back. And so that's important if a child has to wear glasses when they're playing sports, it's very important that they have something that's safety rated, because those glasses can become an injury in themselves if they get hit just right. Yeah.
Safety gear is definitely, it's super important. I mean, if the pros wear it and can look cool or not look cool, but they're still wearing it, you should too. You think about the shin guards and those kind of things that in baseball now, they jog to first base and then they take all this equipment off and hand it to the first base coach. Well, they do that because, they're wanting to prolong their playing career. And if we're ending somebody's playing career in middle school or high school, it's much more damaging to their life down the road. It's not just school sports that we see this with. There was just an article probably about 2 weeks ago that listed pickleball injuries as being a huge up and coming kind of issue that we're seeing. And that pickleball, you might think, it doesn't go that fast. Well, it comes off that racket at about 60 mile an hour. It slows down quickly because it's kind of built like a wiffle ball. But if you're catching that ball off a bounce or directly to the face when you're in the kitchen, I think, on the racquetball court, or the pickleball court, then you can actually get a pretty severe injury. And we're seeing a huge uptick in those from retinal detachments from the impact, because the ball is really hard. Even though it's like a wiffle ball, it's a hard plastic. We see Nerf gun injuries.
Oh, that was one of my favorite. I had a dad come in, and his son they were playing Nerf war, and the son shot him at fairly close range with a Nerf dart in the eye, and it caused the front of the eye, the colored part, the iris, to bleed. That's actually an eye emergency, and that poor dad had to rest in bed and no movement and lots of eye drops for about 5 days. He couldn't do anything until that bleeding stopped, because it can cause some pretty severe things. So I was the mom that made my kids wear safety glasses during Nerf war. Again, I'm not cool, but hey, nobody had a hyphema, which is the bleeding inside the eye from a Nerf dart. But Nerf darts can be pretty wicked.
Yeah. And, you might think, oh, I can just grab a pair of regular safety glasses off the shelf. They're going to be fine. They are probably better than nothing.
Oh, absolutely.
But there are different regulations that kind of cover safety eyewear for different things. So ASTM is the one for racket sports. There's one for baseball and those kind of things, because it's a much heavier ball moving very quickly, and it has to be able to withstand a much higher level of impact, depending on what you're doing. Airsoft is another one, and paintball. I mean, those are things that we see literally all the time, is people, oh, it's an airsoft gun, I can shoot my friend with it. Well, even if it bounces off a wall or something else, that little plastic BB can cause some damage.
So shooting sports are a big thing around this part of the world where we live, and they tell you should wear safety glasses when you're shooting. And again, there's multiple reasons. If something should ricochet and come back and hit you, but also as you're shooting, things coming out the back of the gun, they can also get you. I don't shoot. He does. He could probably tell you more about that than I do.
Depending on the type of weapon you're firing, there can be actual powder. Like revolvers have a significant burst of powder between the cylinder and the barrel, and that it can burn your hands. It can cause debris to fly, and it can be an issue. You might also kind of think about the really rare situation, thankfully, where a bullet or a shell doesn't go off. Well, getting that bullet or shell out of the gun is kind of a risky procedure. So, just be careful out there, people. It's we all like our sports, we all like our activities, but we want to be safe while we're doing them, so we have a lot more time to do them down the road.
Yeah. I think the last one we'll visit about is sun exposure during sports. I have a tennis player that was brought in with bright red eyes and sun sensitivity, and he got sunburned eyes from playing tennis. And so now he's required to wear sunglasses while playing tennis. The nice thing is, again, there are sunglasses and glasses that are specifically made for each sport. There's many things that go into it, not just the safety features, but also the vision. Certain types of lenses are better at picking up red stitches on a white ball or white on a tennis ball. And so we can definitely help you figure out which ones are best. But protecting your eyes at all times is always an important thing.
Yeah, and if we can protect your eyes and improve your performance at your given sport, it's a win-win.
I always tell patients I do not claim to improve your golf game, so please don't ask.
I won't improve your golf game either, but you will see where it went into the rough.
Yes. Well, thanks for joining us again for another episode of I Wonder Wednesday. Like us and follow us.
YouTube, Facebook, and Instagram.
Perfect.